Mashhour, this question for you. In your experience, which health factor tend to be overlooked by pilots yet have significant impact on performance?
So in aviations, a lot of the small things unfortunately get overlooked. So we have something called the Swiss cheese model, where small things accumulate and overlooked with time. We can start with the nutritions, especially what we call the sugar jack. So they will eat a lot of sugar before flying, and then they will have this drop of glucose, which sometimes will affect their concentration. And then we have the subclinical sleep deprivation, which can affect their decision, and they will have what we call delay in response. Also, nutrition is a big factor. So one of the things that we concentrate on is vitamin A, where it's work on the rods. So for the night vision especially, when you're deficient in vitamin A, your night vision, let's say, sense will be decreased, and that will not affect you in the morning because we have the cons. So nutrition is also a big factor, and also stress. A lot of pilots, they have a lot of stress doing in life, and then when they go in, they cannot disconnect from these things, and that will cause them to have this delay in response. So basically, it's not one thing; it's kind of multiple factors.
Okay, moving to you, Dr. Abdurrahman. Tell us about the case or scenario that demonstrates the importance of early medical screening for the pilot.
I think following what my colleague, Dr. Mashhour, mentioned about the risk factors, especially when it comes to the chronic disease risk factors, one of the main risk factors is a chronic artery disease, diabetes. All of these risk factors need to be screened early to detect any issue with the pilots. So when you talk about scenario, there are some scenarios where we have in-flight incapacitation due to a cardiac disease or a heart attack. The regulation in most of the regulatory aviation entities, they don't require an invasive or stress test for the ECG. They require a resting ECG. The question is, do we need to introduce such intervention, such diagnostics to the medical exam or to annual medical exam to make sure that pilots with high risk or moderate risk should have this kind of test? And as you know, like 10 to 15% of in-flight incapacitation are related to the cardiac disease, which is leading sometimes to a fatal accident and so on. So screening for chronic disease, whether it's cardiac, diabetes also is a good example. And it's also reversible sometimes if you have a patient in a pre-diabetic phase. You can if you screen them early, change their lifestyle.
Sorry, let's stop the side talks, please. Doctor, they explained to us a very important information. Thank you.
I think no one is interested in doctor's talk during an aviation show, but that's fine.
It's really interesting.
That's
it
fine.
does.
No problem.
Yeah.
So diabetes also, I mean, if you screen diabetes early, discover someone in pre-diabetic phase, you can reverse that by lifestyle, by exercise, by changing the diet, and that's very, very good for the pilot to maintain his career and to fly safely. Thank you.
Thank you, Dr. Abdurrahman. Moving to you, Dr. Mashhour. Share insight on how stress, long hours, and fatigue directly influence a pilot's cognitive abilities.
So interesting enough, now in the aviation industry, they start to look at stress. They start to look at stress as actually as a hazard and not punitive action on it. So stress always play a lot of effect, and as we move from being a blaming kind of framework to a more supportive one, where even your colleagues could help you with that stress, and even if that went to us as Ngaka, if someone is under a lot of stress, we will not do this punitive actions because we're gonna hopefully soon gonna see it as a hazard that we need to mitigate and help the pilots with. The only thing that is different for us between commercial and general aviation, in commercial, it's most of the time it's co-pilots with you. So there's always someone that you could kind of get help from and put you back on track. The problem with general aviation, most of the time it's a single pilot. And that means that you are your own also check. So you have to check again by yourself, to yourself. So usually I spoke with Captain Mishal Sderi, who told me that he ran his checklist twice. So he's checking himself again. And that needs a lot of cognitive presence. With that being said, also the other problem with general aviation, the engine have like a 95 decibel, which actually very annoying. I mean, I have a lot of friends who fly solo, especially with the one that have no ceiling, what we call the open cockpits. So they have a lot of stress in going, the wind, they're alone in this plane. And that's why we're trying not to point fingers and change this blaming cultures to more of it's a hazard, have nothing to do with you as a person, and we all should work together to decrease the stress level.
Indeed, Doctor. Moving to you, Dr. Abdurrahman, how do you approach a long-term health monitoring for pilots in a way that supports both safety and career?
So this is very important question, and I don't think it's a pilot specific or aviation specific.
True.
I think the whole world is moving toward proactive prevention and well-being, and refraining from being reactive to all these diseases. Taking care of your health as a pilot or as any individual is becoming priority. Not to fly an airplane, it's just you need to live a longer and healthy life with good quality. And you can see the trend, even here in the kingdom. Most of the things that's happening here in the kingdom, whether it's in the transformation or as part of the health transformation in the kingdom, is directing everything toward prevention and for people to live longer and healthy. And that applies on the pilot also. And if you go and check the annual exam of the pilots, most of it is what any individual needs to do to stay healthy. You need to control your chronic disease. You need to stay in a good physical shape. You need to make sure that you manage any chronic disease. You need to sleep very well. You need to, all of these things is part of what longevity studies is doing, part of how to stay healthy. And we have achieved that even in the kingdom. When you look at the life expectancy in Saudi Arabia, it used to be 74 years for in 2016. Now it's reaching 79.7. So we are reaching 80 years life expectancy because of introducing lifestyle changes, chronic disease management, and embracing the prevention. So it's not about your health, it's not about the career itself, it's about your health as a pilot. You want to stay healthy even after you leave aviation. So that's the main concept of how to stay longer and healthy as a pilot.
Following your answer, Doctor, it's my question for both of you, doctors. From a clinical perspective, how do the lifestyle choices, nutrition, sleep, and exercise shape pilot performance? With you, Dr. Mashur.
We could always like cycle back to the first challenges that pilots face. So when I was an aviation doctor back in Montreal, Canada, I used to see a lot of nutrition problems, exercise problems, and also weather. What's interesting difference that I guess a lot of pilots need to think about is when you fly in cold weather as a single pilot, the air pressure will be actually higher in the same altitude, giving the density of the air because of the cold. When you reflect it back here in Saudi, where we have more of a sunny weather, the air density is actually less. So even if you're flying in the same, let's say, altitude, you're having different pressure. Unfortunately, that effect, though it's a fact, it's not reflective on your oxygen saturation. So I have a lot of my friends who fly in cold weather with the pulse oximeters, and they call me or take pictures of their oxygen of 85 or 90s, and they think that is actually a real number. When in, for example, cold weather, there is something called vasoconstrictions, and the flow of your blood in the fingers is actually not accurate. It's a barrier. Also, if someone have a nail polish on them, darker skin pigmentation, so that always give this kind of false reading of your oxygen saturation and your need of increasing the flow if you're having an oxygen tank with you. And that's just circle back to what His Royal Highness Prince Sultan said. It's one thing to be a pilot, and it's another thing or another level to be an aviator. So as an aviator, you have this wider understanding of all of these medical engineering aspect of that. I think today me and Dr. Abdulrahman were covering one aspect, but as a pilot, you need to also cover the other challenges that they have.
Back to you, Dr. Abdulrahman. How do you balance a strict medical standard with the need to support pilots who are dealing with a treatable condition?
Well, this is one of the core question in the aero space or in the aviation medicine. One of the most of the ethical question, how to make sure everyone is flying and flying safely. At the same time, not all pilots are completely healthy. They have some conditions. So how to balance between allowing them to fly for their own safety and grounding them. And the principle, the easy one is safety first. If you think his condition is bearing any risk on the pilot himself or on the flying itself, you don't allow them to fly. If the condition is treatable, if the stability of the condition is controlled, then here come the special issuance of certification of allowing the pilot to fly under certain or more restrict conditions. And maybe Dr. Mashur can elaborate on this part better than me, being at GACA. But that's a very, very important question to discuss. And I think it starts always from the pilot, him or herself, starting by being honest about what condition he has, whether it has any mental issue, he has any preconditions need to declare for the medical examiner or for the medical team. These are very, very key points. And at the end of the day, it's a joint responsibility between the pilot and the medical team who is issuing this clearance for them to fly, to decide whether it's safe for the pilot to fly. I don't know if Dr. Mashur.
Do you have something to add, Dr. Mashur?
No, I think we have covered most of. For stress is always a big issue for pilots. Going back, they're not under a commercial companies. Most of them are individuals. So a lot of self-awareness needed to be by them. They have to declare most of the things, which is not the same when you speaking to commercial pilots, where they are mandated to do their yearly checkups for the company and also for the regulators.
Mentioning the stress, Dr. Mashhour, what role does the mental health play in aviation safety, and how is it being addressed within a pilot medical framework?
So mental health now and stress have been a big issue for aviators all over the world. In the past, maybe the engine, the medical stuff was taking most of the talks. But as we advance on our treatments and health issues, we have been seeing a lot of these mental issues. And I think that also goes back to there's a general advancing on people actually declaring their challenges, which we didn't have also in the past. We start the mental health talks maybe 15 years ago, and at that time it was something that the pilots will hide, and then we have to go around them to find that they actually following someone or they have this mental breakdowns. And I think this kind of attitude make the problem worse from the regulator side and also from the general aviation pilot side. So now we're going to more of it's like a hazard. It's not the pilot. It's not something that will make the pilot grounded. We're gonna help you to navigate and mediate this hazard. Also, once you have this connection with pilots, I have been seeing them back in Canada or also here in Saudi. Once they know that you're actually trying your best to get them back to flying, and you're only doing this just to make them safe, that's changed the whole conversations, and they will actually open up more to you, and that's going to give you a clear understanding of what the challenges that they have, and you finally could just address a plan, and you agree on that plan. Some of them will be okay also to have a co-pilot with them sometimes. Some of them will tell you about some of the medication. So the problem is when they go start a new medication, we have this, what we call like a grace period, where they have to stay grounded just for the side effects of that medication to declare itself. And then once that happened, we could treat that side effects or clear them if they don't have any, and they will go back to fly again. So I think once we have this environments where we're non-judgmental with mental health, as we, alhamdulillah, are going here in Saudi now, these challenges will be less. People can share it with their other colleagues. And also, if one of their colleagues find that his co-pilots or his friend who is flying with is having these challenges, he will not feel afraid that if he contacted, let's say, the regulation or the club, that his friend will lose his license and he will go to this like a black hole where your certificate get denied and all of that. So I think we're actually advancing quite well on that manner.
Thank you, Dr. Mashhour. Moving to you, Dr. Abdurrahman. Pilots often push themselves at the limits of physical endurance. How do you counsel them on balancing ambition and health?
I think all pilots are ambitious, and we have especially the young pilots, and sometimes they push their limits, and they don't want to show any signs of weakness. They want to achieve more goals. They want to get to their destination faster. You don't want to show their colleagues that they are tired or something, and that's really, really dangerous. We should take our physical fitness very seriously. They should take the amount of time they recover very important. It's like an athlete. you should recover as much as you. If you want a peak performance, you have to have a strategic recovery. So without that, you cannot, you will push yourself to a limit. You will be excited for some time, but eventually the curve will go down and you will collapse. So it's very important for pilots to consider that. Actually, staying awake for 17 to 19 hours is equal to alcohol level of 0.05%, which is just below the level of you are not allowed to drive, let alone flying. So considering these things during your checklist, during your preparation for the flight is very important. You are not challenging anyone when you fly. I've been with a lot of pilots who are trying to get to Europe faster when you talk about the general aviation. They just need to hop from airport to airport to get to an area before sunset. You don't have to do that. If you cannot do it, just don't do it. Stay wherever you are, get some rest, and you fly next day. So it's very important to consider the recovery the same way you consider your performance or your achievement. نسمعك احنا نسمعك.
Thank you, Dr. Abdurrahman. This question for you both, Dr. Abdurrahman and Dr. Mashhour. How can we encourage pilots to be more proactive about preventive health rather than reactive to symptoms? Start with you, Dr.
yeah.
Mashhour.
So one of the things I have been sharing with my fellow pilots here in the Sound and Fun, it's which was like one thing that I picked to talk about. There's a lot of things to share, but I choose one for this conference. So the one is the noise exposure. So as you go to your plane, the decibel on that engine could reach up to 85, 90s, which if you fly on that decibel for 8 hours, you're exposing yourself to losing your hearing and not performing well on the audiogram, which you're going to do on your next certification. So I think wearing what we called either the active noise cancellation, ANC, or the BNC, which is the passive one. Some of them also will use the ear plugs. Always remember that you have a lot of noise in your engines, especially if they're non-cockpilots. And if you fly with an 85 decibel noise for 8 hours, you're at a higher risk of losing your hearing sense or declining, let's say, your hearing sense. The problem with the noise exposure, it's not like a one shot. So you're flying, you have a lot of exposure to noise, and then you come down, and then you're going to call me, Dr. Mashhour, I hear fine. You're lying. Which is that going to be? It's actually about the repetition of that. So if you do that one time, it's fine. But if you do it 100 times, then that's going to affect you. So it's a chronic exposure that you need to be aware of. So always, as an advice, make sure that you're wearing at least ANS or BNS or your earplugs for that kind of hazard. And it's in a long talk about what we call pilot longevity. So at GACA, we're pushing hard now to we want to increase the age of certification. Now the age depends on the pilots. We range from 60 years to 65 years. We have some exceptions, which is case by case, and we go up to around 70 years of age, and we give them a full certification as Class 1. Hopefully, with advancing with the conference like these, and the pilot understanding of these risks, we can actually make it a standard and allow to go up now to 68 for everyone. And instead of doing it case by case, make them go through a lot of investigations and checks beforehand. So yeah, there's one thing to talk about, they say the noise exposure to stay fit for longer time.
And for you, Dr. Abdurrahman?
I mean, maybe I shed some light on this question earlier, but I will add the mental health part, which is very important. How to take it proactively. I think we shouldn't be waiting until we have severe symptoms for depression or anxiety to start seeking attention or start looking for advice. I think that should be a part of our routine checkup. That we do on a regular basis, not even on an annual basis. And that's part of being proactive to take care of your health instead of waiting to have a severe symptoms, then you start seeking advice and make the treatment more complicated.
Thank you, doctors, for enriching information session. Thank you.
خلاص؟